Thanks for joining us on the media briefing today. We're already starting to talk about fire season, although fire season seems to get longer each year, but here we are talking about it again. And very pleased to have Kelsey Scanlon and Gary Millay from the Office of Emergency Services to talk about wildfire awareness today. Hi, how are you guys?
Hi, Maya.
So get us started. What should we be knowing about wildfires this year? What kind of awareness are we wanting to share with people?
Well, I'll go ahead and start. We rely on our partners quite a bit for information about the predictions for the upcoming wildfire season. The fire services rely quite heavily on their own meteorologists and those at the National Weather Service. And the National Weather Service has predicted this to be a pretty severe wildfire season, mostly because we've been in a partial drought for the last 12 months. However, the rainfall that we have had has really allowed the flashy fuels like grass to really grow quite rapidly. So in the fire service, those flashy fuels are what we call ladder fuels to the timber and the larger trees that create a real wildfire situation that burns hundreds of thousands of acres. So the outlook this year is pretty severe. We don't anticipate any more moisture. The moisture in the fuel, in the 100 and 1,000 hour fuel, is pretty low compared to normal for this time of the year. And as indicated by the fact that the fire service has already declared that fire season has started, when typically it doesn't start until June. Did you want me to just go into talking about wildfire preparedness, or did you have some?
That would be great. I was just unmuting myself. Sorry about that. What can we tell people about how to prepare? We have both urban and rural areas, but everyone needs to be ready.
Yes, they do. And obviously it's a different scenario for an urban resident than a wildland interface resident. And that's a term that started a few years back. If you're not familiar with it, if you live anywhere near the what we call wildland vegetation that grows naturally, there's several different kinds of brush, sumac, and different brush and low-lying plants that can grow anywhere from 4 to 20 feet in our community. If you're anywhere near them, you're probably in what we call a wildland interface situation, where if fire was in that vegetation, it could easily then spread to structural components of the county if you're not careful. So what we really try to advocate to people to prepare is to know your space and prepare your space. Okay, so in other words, look at your personal situation and look at it with just a common sense eye. The key to protecting your property from the exposure of a wildfire that's in vegetation is defensible space. That's the primary key. In other words, if you have an adequate distance from the vegetation to your property, to your structure, then the greater that space is, the less likely that fire will spread to your structural components. Now, there's a lot of keys that go into that, specifically vegetation on your property. When we say defensible space, because you have just nice looking trees on your property, they have to be maintained the same way that the wildland does, so that fire does not spread from a vegetation wildland situation to your property to then expose your structure and burn your house down. Ornamental vegetation, the plants that you have planted for decoration, are also very much the cause of spread from vegetation fires into the structures. So you have to look at your vegetation, make sure that that the bottom 1/3 of the plant or tree is trimmed so that there's nothing near the ground, so that if those flashy fuels were ignited, they're not going to necessarily catch your bushes or trees on fire. And then you need to actually look at your home itself. There's several things that can be done to what we call harden your structure from the exposure of fire. Obviously, the number one thing would be the type of roof you have. Now, in California, wood shake roofs have been outlawed for over 20 years, but that does not mean that people still don't have them. It was not a law that required people to retrofit existing homes. If you have a wood shake roof, I would consider yourself lucky that you still have that roof and haven't burned, because those are just a terrible way for fire to spread from a wildland situation to your structure. But even if you have a tile roof, the way that tile roof was installed really matters, because there can be gaps. Typically what happens in a wildfire situation is heavy winds are blowing, the fire creates its own weather, and an ember field will be spread sometimes up to 2 miles ahead of the fire. And those embers are quite hot, and they get underneath your spaces in your roof tiles. And what's underneath those spaces is plywood typically, and that plywood will catch on fire and still burn your house down just because of the embers. So those are things that what we call hardening. Another way for embers to get into your concealed spaces, such as your attic, is through your vents that are required by the building department when you build a structure. So those vents just have small screens that keep out the rodents and other debris, but embers go in just as if there was nothing in the way. So dampers can be put on those vents at a very low cost, so that if fire was approaching your house, or if they're on actually a heat sensor, they can close automatically, and that's a real good way to help protect your attic from the fire. The outside of your structure itself, you should look at to make sure it's not a combustible material. Many homes are built with wood siding, and that's not necessarily the best way to keep your home hardened against wildfire exposure. As in general, with all residents of the county, we tell them that they need to prepare themselves as well as their property. You need to have an emergency supply kit. Now you've heard us talk about this in the past. We really try to, slam it into people's heads so they won't forget. But one of the key components of your emergency supply kit is water and food. If you are in a wildland interface area, you may be cut off from evacuation routes where you have to, even if your house isn't directly exposed to the fire, you may not be able to leave. And so we want you to have at least 1 gallon of water for every person in your house for 7 days. And same with food. You need to have a 7-day supply of non-perishable food that you can live on, because you may not be able to get out for that 7-day period of time. If you are a person that requires medicine, then you need to have a 7-day supply, and you need to talk to your doctor and pharmacist ahead of time so that you can get permission to get more prescription than you can use in the 30 days typically that they like to prescribe. We tell everybody that they need to have a go bag, so that if you can evacuate, you just grab your go bag and leave. And that has a lot of the essentials that you're going to need if you're outside your home and can't return to your home, such as a first aid kit, such as extra prescriptions, such as additional money, electronics and chargers, sanitation items, clothing and blankets. You don't want to leave your house with just the clothes on your back and then have to rely on going to Walmart to buy new stuff because you can't go home for 2 weeks. It's very important that your go bag include, assistive technology if that's something that you need. So those are all things that we recommend. They're in your emergency supply kit. It really, if you are stranded in your home, we like people to have kind of a section of their supply closet that has some camping gear, because if your power goes out and you can't, and your home is just basically a box protecting you from the weather, you have no electricity, no utilities, then you may need to have camping supplies such as a propane camp stove to cook your non-perishable goods that you have on supply. So that is, those are things that we really try to get people to recognize. It takes a little effort, but same with that, we want people to have a plan. And that plan includes your entire family, how to leave your area safely, or how to stay in your area safely. That's something that you need to discuss with your other family members so that everybody understands. You need to have somebody outside of your area that you can contact to tell them you're okay or to tell them that you're not okay. In many cases, cell phones or phone lines will be down. So if some form of communication tree is set up ahead of time, that's very, very valuable. You need to document your valuables in your home. In the terrible tragedy that you get out safely, but your home does not survive, you are going to save yourself and be more resilient if you have documented all your valuables, preferably photo documentation that you have either stored on your smartphone that you're taking with you or uploaded to a cloud that you can download at any point. And that includes taking photo pictures of all of your important documents that you have in your fireproof safe. The myth of a fireproof safe is that it's really not burn proof, it's only fireproof. The inside of a safe can easily get to 800 degrees with fire impinging on it, and the safe itself might survive, but all of the paper that burns at 400 to 600 degrees inside will be ash when you return and open your safe. So we really want you to be informed of what's happening in the emergency. We try to ask everybody to sign up for Alert Monterey. .org so that we can get emergency notices to you so you can stay informed. If you have to evacuate, please evacuate quickly but carefully. You've already prepared your home. There's nothing more important than your safety. Please follow evacuation instructions. And if you're asked to evacuate, do not stay in your home. The responders will, as much as they can, try to rescue you. But by doing so, they're taking themselves out of the firefight, which are protecting the greater area. So those are really our keys to preparedness. And as always, these things are posted on our Office of Emergency Services website. We have a very robust website and an incredible website coordinator that is also on the line to tell you about all of the things that she does. But our office is always open for individual instruction or just obviously the interviews that the media asks of us, but people can call us and just if they have questions on their own preparedness. So with that, I'll turn it back to Maya, and then I know Kelsey has some things to talk about what's happened in our recent fires.
Yeah, I just want to capitalize on a couple of points that Gary had made. He mentioned all these different strategies. And I know some people are like, well, maybe I'll just do one here or one there. It really is the combination of all of those efforts instead of just one that makes a home and a family resilient. From working with our wildfire survivors from the Carmel River and Dolan fires, I have to say that the ones that are the most resilient were the ones who did the defensible space and did the home hardening, and they had the go kits, and they had their documents saved and ready to go on a cloud. They are by far leagues ahead of some of the other wildfire survivors. And it was because they did all of the things, not just one of the things. And Gary really hit on a point. It's the insurance. Please document everything in advance. A lot of these property owners are having to go back and itemize their personal belongings, which after 35 years is an extensive list. And so you'll save yourself a lot of time and heartache by doing it up front now. So those are, I think, the main points.
Thank you very much, Kelsey. And I did put the preparedness page, a link into the chat. If there are other links on your website that are more specific to like the go bag, what to have in it, if you could please add those, during the briefing too, that would be great. Thank you both very much. And if you would stay on the line for some questions later, that would be terrific. Now we're going to move on to our friend Laura Kirshner, who's a business services specialist with the Workforce Development Board. She is going to tell us about some upcoming job opportunities for people who are looking for work, as well as a webinar for employers that will help them really navigate some changing COVID relief and response regulations. Hi, Laura. Thanks for joining us.
Hi, Maya. Thanks for having me today. Appreciate it. Yeah, we've got a couple of really interesting things coming up. May 13th, we are gearing up for our Hospitality and Tourism Virtual Job Fair. We are inviting any job seekers that want to test the waters safely to log on from the privacy of their own home, in fact, to learn about opportunities in hospitality and tourism. We've got 22 employers that are signed up for this, and it's some of the big ones from the area. So anybody who's wanting to know a little bit about some opportunities is invited to join us. They can log on to our website. They will need to register in advance. So you can register from our website, montereycountywdb.org, and I put that in the chat earlier. You can upload your PDF resume to the Premier virtual system and just test the waters. We're encouraging everybody to do that now. You know, there's a lot of jobs out there, and I think that you're missing out if you're not taking advantage of stuff now. We don't know what's going to happen in the future, but we think there's going to be millions of people going back to work at the end of the summer, and you want to be ahead of the curve. So this is an opportunity for you to test the waters, learn what's available in Monterey County. There's some really good employers that are hiring right now, and you don't want to be left out. So again, make sure that you upload your resume ahead of time, that you're prepared and ready to go. And join us on May 13th. It's from 10 to 1 p.m. Again, you do it all from your own home, on the Premier virtual site, and you'll have access to those 22 local employers who are ready and waiting with bated breath to hear from you. We've also got a webinar for employers that we definitely want local businesses to know about, and that will be on May 25th. Let's see, and the time for that, I believe I put that in the chat below. But again, you can register on our website, montereycountywdb.org, our local employers. And it's a COVID-19 update, emergency paid sick leave and paid FMLA, sponsored by the Monterey County Workforce Development Board. We're teaming up with the California Employers Association. And we know that regulations, especially around COVID, can absolutely leave your head spinning. So we're here to break it all down for you in terms of what everyone needs to understand and to work with. It's a free 1-hour discussion that will address the newest versions of the Federal Family's First COVID-19 Response, which provides emergency paid sick leave, emergency family medical leave, and employer tax credits. It's also going to cover what the Family First Coronavirus Response Act is, the emergency paid sick leave, who must provide it, how much leave is required, and what can the leave be used for, and how much are employees entitled to be paid. Emergency family medical leave, who must provide, how much leave is required, and what can this leave be used for, and how much employees are entitled to be paid. Tax credits for employers, unemployment insurance updates, posting, and other administrative requirements. So again, that will be on May 25th. And from 9 to 10 a.m. They can get to that from our website, montereycountywdb.org, and register to attend. That's a free service through the California Employers Association. One of the other free services that I wanted to mention is the hotline number, which employers can take advantage of at any time, and that's the Monterey County HR Resources Hotline for employers. And I'll put the number in the chat, but it's 1-888-217-6899. And that's your tax dollars at work. So if you have any questions about HR or how to navigate the ever-changing legal system that has become HR, encourage you to call that number.
Thank you very much, Laura. Thanks for passing on all that information. If you would stay on the call in case we've got some questions for you after our other presenters, that would be great. Thanks very much.
Thank you. Will do.
All right. Our next topic is Laura's Law. If people were connected up with the Board of Supervisors meeting yesterday, they know that the Board of Supervisors voted to opt out of Laura's Law, which is AB 1976. Counties are able to opt out if certain conditions are met, and it is a complicated topic. And we're very pleased to have Melanie Rhodes, who's a Program Services Manager with the Monterey County Behavioral Health Bureau, to help tell us more about this and share some of the information that was brought to the board yesterday. Hi, Melanie.
Hi, good afternoon. Thanks for having me. As Maya said, I'm here today to talk about the resolution that was approved by the Board of Supervisors yesterday for our county to opt out of assisted outpatient treatment. Over the past several months, behavioral health leadership has thoughtfully reviewed and considered AB 1976, the legislation for assisted outpatient treatment, also known as Laura's Law. We examined what it requires and what services we are already providing within our behavioral health continuum of care. We also engaged key stakeholders on this topic as well, including consumer and family advocacy groups, NAMI, the Behavioral Health Commission, the Health, Housing, Homelessness and Human Services Committee, as well as others, and hearty discussions were had on this topic for sure. With the support of stakeholders, however, we went to the board with the recommendation to opt out. Here in Monterey County, behavioral health already offers a continuum of services that truly embody the spirit of AOT, and we believe go above and beyond what is expected by assisted outpatient treatment. AB 1976 outlines specific services that must be offered to a specific target population, and those services include community-based care, low client to staff ratios, outreach and engagement, crisis intervention and engagement and evaluation, substance abuse services, family and peer involvement, housing support, medication support, vocational services, and services that are culturally and linguistically responsive. Behavioral health currently offers these services as well as the following additional services. We have collaborative courts for mental health, drug treatment, DUI, veterans treatment, and military diversion. We also have mental health diversion, misdemeanor competency restoration. We provide services to the AB 109 reentry population, high-risk probation population. We have crisis residential services that can be used to avoid inpatient hospitalization or as a step down following psychiatric inpatient care. We have day treatment programming, acute psychiatric inpatient care, LPS and voluntary commitment for those who are a danger to themselves, others, or gravely disabled. And moreover, we have a mobile crisis team and a mobile response team specifically for children and youth that are age 21 and under and their families, as well as assertive community treatment or ACT teams and full service partnership teams throughout our county, which focus on outreach and engagement to high risk and difficult to engage populations. AB 1976 is an unfunded mandate that outlines specific services that must be provided to individuals meeting very specific criteria while not allowing for a reduction in existing programming levels for implementation. However, the decision to seek a resolution to opt out of AOT was not solely a financial one, but instead because we believe the program offerings that we have not only meet but exceed what is required under AOT and actually serve our community members better than Laura's Law would. We believe that building trust and developing relationships through outreach and engagement are best practices for helping people to get connected to treatment and on the path of recovery and long-term recovery. Overall, behavioral health served more than 13,000 individuals last fiscal year. We've seen a 25% increase in the last 5 years and a 69% increase in the last 10 years. In the last fiscal year within our adult system of care, we saw a 17% increase in new clients with severe mental illness that were served. And these were people not previously opened in our behavioral health system or not previously seen in our behavioral health system of care. We've served 32% more people in the last 5 years and 49% more people over the last 10 years within our adult system of care. So we are successful at outreaching and engaging with folks. I think also worth noting is that while the resolution to opt out of AOT was approved yesterday by the board, this is something that will continue to be reviewed and brought back to the board on an annual basis, and something that we will continue to look at. And that concludes my statement.
Thank you very much, Melanie, for that really thorough look at the topic and then what happened yesterday. If you would stay on the call, if we have any questions for you, that would be terrific.
Sure.
And now we're going to turn to a little bit of a happier topic, a little celebration. It's National Foster Parent Appreciation Month. And here to talk with us is Laura Neal, the Deputy Director for Department of Social Services. Not only are we going to celebrate our foster parents, but I'm hoping you can tell us there is really a need for a certain group of foster kids that you're trying to get the word out.
Thank you, Maya. Thank you very much. Hi, everybody. Yes, May is National Foster Parent Appreciation Month. So if you know of any foster parents or anybody that wants to be a foster parent, please support them, please appreciate them, please love on them, because we couldn't function without our foster families. And here in Monterey County, we have a need, it's an evolving need for our teens and for sibling groups of children. We don't want to have to separate brothers and sisters because they have to come into foster care. So we're looking to do targeted recruitment throughout all of Monterey in the next coming months, looking for families that are willing to take large sibling groups of children so they stay together. And then for folks interested in taking teenagers, and we're going to be developing a teen-specific cluster of families that will specialize in teen needs and teen issues, and they'll support each other, and there'll be a cluster of foster families that will work together to help our teens, if they can't go home, then to transition them to adulthood. Oftentimes when kids don't have family, they end up to the streets, and we want to ensure that our kids are not only with their birth families and their communities, but when they can't be, that they're with foster families that will take care of them until their adulthood years. So we're really excited about May. We're going to be doing a lot of wonderful things for our foster parents that we currently have, but we're going to also be doing a lot of recruitment to bring in new families to join our family of foster families. So thank you, and that's all I wanted to say. We have about 305 foster children right now, and that number changes every day. But the ones that are most need are our teens and sibling groups.
Thank you very much. Thank you, Laura. And if you would stay on the call, we may have some questions for you. Thanks very much. And then finally, we're going to turn, last but not least, we're going to turn to Dr. Moreno, who will give us a COVID-19 update for today. Hi, Dr. Moreno.
Hi, Maya. Good to see you. All right. So today, with regards to vaccines, just I want to remind everyone that our vaccine allocations by week, our percentage of individuals receiving at least one dose of vaccine by age, race, ethnicity, and zip code are all on our department website. And at this point, approximately 61% of Monterey County residents have received at least one dose of COVID vaccine. With regards to state blueprint, specifically the tier assignment, based on California blueprint case rates and test positivity rate metrics, Monterey County is still assigned to the orange tier. However, the most recent release of metrics by the state shows that Monterey County's case rate and positivity rates met the yellow tier criteria for the first time. And so in order to move into the yellow tier, Monterey County would have to meet the yellow tier criteria for 2 consecutive weeks. So we've met it for 1 week. If we next Tuesday, the state metrics show that we've met the yellow tier for a second consecutive week, then the state should be recommending that Monterey County move to the yellow tier as early as Wednesday, May 12th.
What's up?
Is there anything? Oh.
Sex wife.
If people would mute themselves, if they're not talking.
Okay, thanks, man. All right, and then with regards to guidance, California Department of Public Health has this updated guidance documents as recently as this Monday. A couple I just want to point out, there's updates to the guidance for use of face coverings and updates to the recommendations for fully vaccinated individuals. And those are on the CDPH website. So the guidance documents remind employers that in the workplace, if they're subject to Cal OSHA requirements, then they have to follow the Cal OSHA COVID-19 prevention emergency temporary standards, abbreviated as ETS, so Cal OSHA ETS, and to make sure that their employees follow face covering requirements in those standards. But for the rest of us, as far as face coverings, the updated documents address face coverings outdoors. And so the guidance from the state is that for fully vaccinated individuals, face coverings are not required outdoors except when individuals are attending crowded outdoor events such as live performances, parades, fairs, festivals, sports events, and similar settings. And the other guidance update I just want to point out is with regards to quarantine and testing. And according to the updated guidance, individuals that are fully vaccinated may refrain from quarantine and testing following a known exposure if asymptomatic. And I just want to point out that if individuals here in Monterey County or employers in the area have questions about the updated guidance documents that were released by the California Department of Public Health, then they can call. They're welcome to call our COVID-19 call center at 831-769-8700. If they have questions about the Cal OSHA emergency standards, then they should contact Cal OSHA. And that's what I've got for today. Thanks.
Thank you, Dr. Moreno. And I did put the Cal OSHA website link to those documents in the chat for everyone to share.
Great, thanks, Maria.
So, thank you. And so let's go ahead and start with some of our questions. I see Gary Millay had to step off the call, but Kelsey is still here. So Kelsey, I've got a question for you. Are you concerned about specific areas in Monterey County this wildfire season? Well, she was there. Let's see if I can get her back on, and then we'll come back. We'll come back to that question. Question for you, Laura. Could you mention some of the employers who are attending the job fair?
Yes, thank you so much. I put that in the chat so people could review those, and please feel free to share it. We've got Pebble Beach Company, Monterey Bay Aquarium, Hyatt Regency Monterey, Monterey Plaza Hotel and Spa, Intercontinental The Climate, Monterey Folktale Group, which is the Folktale Winery, 7D Steakhouse, Rise and Rome Restaurant, Mission Ranch, Bernardus Lodge and Spa, Quail Lodge and Golf Club, Post Ranch Inn, Big Sur River Inn, Essalon Institute, Club Del Monte Catering, Hoffs's House Hotel, Colton Inn, Inns of Monterey, Cannery Row Management Company, the Sardine Factory, La Playa Carmel, Old Fisherman's Grotto, Cafe Fina on Fisherman's Wharf, and Monterey Salinas Transit. So we've got some of the big ones in the area. Definitely want to invite people to try out our new Premier virtual site. It's a lot of fun. It's the premier recruiting platform for employers and job seekers. This is where folks are connecting now. So give it a try. It's a lot of fun. You can upload your PDF resume and then be ready to go.
All right, thanks very much, Laura. Our next question, and I believe this, Melanie, this question is for you. If the county believes it already provides many of the services required by Laura's Law, what would opting into Laura's Law have done? And additionally, is this something the county has done in the past but chose not to participate this year?
Sure, that's a great question. And just to sort of maybe clarify and briefly summarize. So Laura's Law is not new. It was initially passed in 2002 and it was AB 1421 at that time. And initially it was an opt-in for counties. So we would have had to go to the Board of Supervisors to get a resolution to opt into the program. So in August of 2020, AB 1976 changed that to making Laura's Law an opt-out rather than an opt-in for counties. So it shifted some things there. So it's not something that we had participated in before and then now are not. So just to clarify that, and really the intent, what is for individuals who have difficulty maintaining their mental health stability, for those folks who are not engaging in treatment and their mental illness is impacting their ability to stay safe in the community. And what Laura's Law back in 2002, set out was a civil, not a criminal process, but a process to go to the court so people could be court ordered into mental health treatment. Another important aspect of this, however, is that it doesn't require people to take medication. So that it requires, some outreach and engagement efforts by behavioral health staff, as well as certain administrative things that really would be burdensome on our system. And, and again, neither in 2002 or again, under AB 1976, there wasn't funding that was provided to do that.
Thank you very much, Melanie. Our next two questions are for Dr. Moreno. Dr. Moreno, are there additional challenges in vaccinating children ages 12 to 15 as opposed to those 16 and older? If so, what are they?
Okay, thanks, Mia. Yeah, I'm not certain about additional challenges, but I do know that there are some strategies that are being looked at to specifically address that age group. One of those strategies is already in place, and we've been doing this for some time, which is to provide COVID vaccine clinics at school locations. The idea there is that anyone that is associated or affiliates in some way with or connects in some way with a school, a campus in particular, that's a place that they're comfortable with, they're familiar with, and getting a vaccine in a familiar setting may help alleviate some concerns or hesitancies that some people might have in terms of getting the vaccine. We've been doing that. We've done that with flu vaccine. We've done a few clinics with COVID vaccine, and we've kept them open, which means we don't want to restrict it to just the school students who are brought in by their parents. We want anyone who's in the community or maybe volunteers at the school to feel that they can come and get vaccinated as well. So we're looking at that strategy as are other health departments in California. The other strategy that's being looked at at this point by the state, and that is looking at the traditional vaccine for children providers. Those are health providers, typically family practice and pediatricians who receive vaccine from the state and offer that vaccine at no cost to children here who qualify for no-cost vaccines here in California. So we do have quite a few vaccine for children providers here in Monterey County. There are a few of them that have been providing COVID vaccine already to the older adolescents who are able to get it, 16 and older adolescents. And so they're already have some familiarity with giving vaccine to their pediatric patients. But we suspect that there are some healthcare providers who are current vaccine for children providers here in Monterey County and throughout California who have not yet received and stored vaccine and provided that vaccine to their older adolescents. So the state is looking into the opportunities to recruit more of those vaccine for children participating providers to find ways in which to get vaccine to them, and so that they can offer it to the younger adolescents in their practices. One of the challenges that I can think of would be that the vaccines, particularly Pfizer vaccine, requires ultra low freezer temperatures, and many of these vaccine for children providers don't have those ultra low vaccine freezers. So what we are hearing is that the FDA may be considering changing the temperature storage criteria and requirements for some vaccines, which would perhaps allow providers who haven't been able to store vaccine to store vaccine and that is kept viable for a longer period of time in refrigerator temperatures. So if the FDA gets to a point where they have evidence that, for example, a Pfizer vaccine could be stored at a refrigerator temperature, let's say for 30 days, that would probably make it easier for the smaller practices of pediatric care, providers of pediatric care, to accept some shipments and then have that on hand for up to 30 days and use it, knowing that they can use it up to 30 days without it expiring, and then begin to bring in those younger adolescent kids in to get vaccinated.
Thanks, Marina.
Thank you, Dr. Moreno. And if you're not speaking, if you could mute, that would be great. I have another question for you, Dr. Moreno. When do you expect children under 16 years of age would be eligible for the COVID-19 vaccine?
I wish I knew, ma'am, but I don't. And so we'd really have to wait to see what evidence is presented to the FDA. And once the FDA gets that information and a request by the manufacturer to allow an authorization for the vaccines to be used at younger ages, that information would then go to the ACIP that advises the CDC, as well as the Western States Committee that has been reviewing the safety and use of vaccines for Oregon, Washington, and California. And once those advisory committees make their recommendations, it would go back to the CDC and CDPH, and that's what we're waiting for. So hopefully there's enough evidence to show that it's safe and effective at that age, and hopefully there's a quick turnaround time in the recommendations to get vaccine available to those younger population.
Thank you. Another question for you. Are you seeing a drop in demand with Monterey County residents wanting to get vaccinated? If so, what is your plan for outreach to get more residents vaccinated?
So what we're seeing in what some counties are seeing in California, or have been seeing for the last few weeks in California, is that some of the vaccine clinics that are posted and made available to the public are taking longer to fill their appointment slots. And in some counties in recent weeks, there are still vacant appointment slots on the day of the clinic. What we're starting to see here in Monterey County is that it is taking longer for some of the appointment slots to be filled. So it looks like individuals that wanted to be vaccinated right away have, most of them have found a way to get vaccinated. And now we're looking at the group of individuals that have been thinking about getting vaccinated or really want to get vaccinated and finally found the assistance they needed and support they needed to get an appointment. Those are the ones that are getting vaccinated and filling up the slots now. And we have, I think, what we're seeing now is those that have been waiting and maybe hesitant are not taking up the opportunity, because there's plenty of appointment slots that are open right now to get vaccinated. So that is something that we, of course, anticipated because we know with other vaccines, including the flu vaccine, there are people who make every effort to get their flu vaccine every year, and those that are a little hesitant and need a little reassuring from a variety of sources, and those that just will not get their flu vaccine every year. So we anticipate that this might be the case. Monterey County Public Health is just one of many vaccine providers in Monterey County that are making efforts to try to bring people in who might be a little bit hesitant. So I can't speak for the other vaccine providers, but for us here in Monterey as a public health, I can't speak for our public health as a vaccine provider. We are looking at finding ways to get to those individuals that still want the vaccine, but are still struggling to find a way to get an appointment to get vaccinated. So we're working with one of our partner agencies, Visiting Nurses Association, who has been going into the community and vaccinating people where they live. And so we are continuing to work with them, and they are, if there's anyone who feels that they still want a vaccine but are struggling to figure out a way to get that vaccine, maybe because they feel or they are homebound or don't have transportation, VNA has encouraged people to call them, and if you do call them, ask for the immunization clinic at Visiting Nurses Association to see if there's ways to see if there's a way that they can help people get vaccinated. In addition to that, I think most or all of our vaccine providers are doing what they can to work within the population that they serve to try to get people who are a little hesitant to get the vaccine to get vaccinated. And I know that some healthcare providers are taking opportunities to, when the opportunity arises, to talk to their patients to try to answer their questions to see why they're hesitant to get the vaccine and see if they can encourage them to get vaccinated.
Thank you, Dr. Moreno. And I have another question for you. How does our vaccine numbers or percentages impact us getting out of the orange tier? What else do we need to do to get out of the orange tier?
So thank you, ma'am. So the way we got into the orange tier is the way we move into the yellow tier. And so we got to the orange tier by people getting vaccinated, by people continuing to use face coverings, and even in situations where the state may say, if you want to, you don't have to wear face coverings. A lot of people continue to wear face coverings. They're most comfortable wearing the face covering at this point in the pandemic, and they may feel that they want to take an extra precaution not to spread or get exposed to COVID. So the way we get to the yellow tier is to continue to keep our distance when we're with households that we don't know, so out in public. Using face coverings where we're required to use face coverings, and continue to use face coverings if you're comfortable wearing it, even though you don't need to wear face coverings. The other would be if anyone has symptoms of COVID-19, whether you're vaccinated or not, it's still a good idea to get tested for COVID-19, especially if you haven't been vaccinated or haven't had COVID-19 in the past. So we'll continue to do what we're doing, and do all of us can do what we can to reassure those that we know and those that we love that haven't yet gotten the vaccine, to assist them in getting to a point where they're willing to schedule that appointment and get vaccinated.
Thank you. And then one final question. It appears, when is the county going to be moving into the yellow tier? And I think you addressed this a little earlier, but you might want to, if you could explain again, what the wait time is and how long a county has to be in certain criteria in order to move. You're muted. You're muted, Dr. Moreno. There you go.
Okay, so we, as of yesterday, Tuesday, California Department of Public Health reported that Monterey County's metrics within the blueprint met yellow tier criteria. And in order for a county like ours to move into a less restrictive tier, which would be yellow tier for us, Monterey County would need to meet the yellow tier criteria for 2 consecutive weeks. So we have credit for 1 week. That was announced yesterday. If next week, Tuesday, May 11th, the state announces that we've met yellow tier criteria again, then according to the state's website, then the state would most likely assign Monterey County to the yellow tier effective May 12th.
Thank you very much for just running that past everyone one more time. That's all the questions that I have in chat. There is, for those of you who are on chat, there's a lot of links in the chat for the topics that we discussed today. So please take advantage of those. And if there are no other questions, that'll wrap up our briefing for today. Thanks everyone for participating. We'll see you next week.